Welcome to Middle Class Matters, Business News in English from Dr CMA Alagesan. Let us see the PMJAY program, PMJAY program, health insurance program, which is under CAG audit. The audit report is read in full. The next part continues. Implementation modes. PMJAY is being implemented in three modes, that is insurance, trust and mixed, as detailed in table 1.3. The states may choose any of the implementation modes. The central government share is released to the state nodal agencies in three installments of 45%, 45%, 10% in case of insurance mode and 50%, 25%, 25% in case of trust and mixed modes. PMJAY implementation modes. Insurance mode. SHA, State Health Agency, selects an insurance company through a tendering process based on market determined premium. SHA pays premium to the insurance company per eligible family for the policy period, which in turn settles the claims and makes payments to the service provider. The financial risk for implementing the scheme is thus borne by the insurance company. Assurance or trust mode. In this mode, the financial risk is borne by the government as the SHA directly reimburses the health insurance providers. SHA employs the services of an implementation support agency (ISA) for claim management and related activities. SHA also has to carry out specialized tasks such as hospital empanelment, beneficiary identification, claims management, and audits and other related tasks. Mixed modes. SHA engages both the insurance and trust and insurance models mentioned above, thus providing flexibility and allowing coverage with the state schemes. This model is usually employed by those states which had existing schemes covering a large group of beneficiaries. As of March 2021, out of 36 states and union territories, 32 states and union territories has adapted PMJAY. Out of these, 21 states and union territories adapted the trust mode, 7 states and union territories adapted the insurance mode, and 4 states adapted the mixed mode. Beneficiaries under the trust mode constituted 62.11% of the total beneficiaries, while the mixed mode and insurance mode covered 27.66 and 10.23% respectively of total beneficiaries. Delhi and Odisha are yet to adapt the schemes. Telangana adopted the scheme in May 2021, while West Bengal withdrew in January 2019 from PMJAY. The following diagram depicts the corresponding mode of PMJAY. 1.6 Financing of scheme. Funding of PMJAY is shared between the central and state governments with the ratio of contribution between center and state at 60:40 in all states except the north and northeastern states, two Himalayan states, Himachal Pradesh and Uttarakhand, and Jammu and Kashmir, a union territory with legislature, where the sharing ratio is 90:10. For union territories without legislatures, the central government may provide up to 100% on a case-to-case basis. 1.7 Significant modules of PMJAY. PMJAY is paperless and functions through an IT system. The IT system includes end-to-end information security and privacy of beneficiaries' data for beneficiaries, portability, grievance management, and anti-fraud measures, etc. The mission of PMJAY for the next 5 years is creating the world's best health assurance program on an efficient and technologically robust ecosystem. Significant modules of PMJAY are detailed in Table 1.4. Table 1.4 Significant modules of PMJAY IT system. Beneficiary Identification System BIS. Module under PMJAY helps verify beneficiaries from the database and create beneficiary registries. Transaction Management System TMS allows for capturing of inpatient data on admission, treatment and discharge and onwards to hospital claims and financial settlement, and consists of two significant sub-modules: pre-authorization module, claims processing module. Hospital Empanelment Module HEM module for empaneling hospitals. Radar and Facts. National Anti-Fraud Unit NAFU, a fraud control vertical of NHA, has identified a certain number of instances which, when detected, the transaction or set of transactions are flagged as suspicious transactions and forwarded to state teams for further investigation at their end. Central Grievance Redressal Management System CGRMS. CGRMS is a system set by the National Health Authority for registering, processing, managing, monitoring, and redressing all grievances from any of the aggrieved stakeholder under the PMJAY. Audit analysis of the data provided by NHA in respect of all 5 significant modules of PMJAY and findings thereon are discussed in the subsequent chapters. Chapter 2 Audit Approach. The audit aimed to examine the status of various activities required to be carried out by the National Health Authority, state health authorities, district implementing units, etc. for implementation of PMJAY and make suitable recommendations for augmenting implementation at various levels. 2.1 Audit Objectives. The audit was conducted in order to ascertain whether the beneficiary registration process is able to include all the eligible beneficiaries and filter any ineligible applicants. B. Whether the controls in the process of empanelment of hospitals, laboratories are implemented in practice. C. Whether the process or controls for reimbursement of claims to empaneled hospitals or laboratories are adequate and are effective. D. Whether the financial management, including release and utilization of funds, was efficient. And E. Whether there exists an effective monitoring system with anti-fraud and grievances redressal mechanisms. 2.2 Audit Criteria. The following were the sources of audit criteria. A. Operational guidelines for the implementation of PMJAY. B. Socio-economic caste census SECC 2011 data. C. Relevant circulars, orders and notifications issued by the Ministry of Health and Family Welfare and National Health Authority. D. Provisions contained in General Financial Rules, etc. E. Physical and financial progress reported under Management Information System MIS available on website of the PMJAY. 2.3 Why this performance audit? PMJAY aims at coverage of a large number of beneficiaries to provide them medical care and reduce out-of-pocket expenses. The scheme involves considerable financial investment by both central and state governments. The audit was taken up in view of the importance of the scheme and considerable financial outlay. 2.4 Audit Scope and Selection. All India Performance Audit of PMJAY covered the period from September 2018 to March 2021. The performance audit was conducted in 28 states and union territories implementing the PMJAY. Each state was divided into different geographical regions and 25% of districts were selected. The process and mechanism of sampling and selection of districts and hospitals are detailed in Annexure 2.1. Entities covered during audit examination included the Ministry of Health and Family Welfare and National Health Authority at the central level, state health agencies, district implementing units, and selected empaneled hospitals at the state level. The sample size covered during the performance audit is depicted in chart 2.1. Chart 2.1 sample size covered states 28, district 161, hospitals 964. 2.5 audit methodology. Performance audit was conducted since inception of the scheme, that is September 2018 to March 2021. Data analysis at NHA was carried out on live server through virtual private network (VPN) till the month of July 2021 and in the states on different dates. The performance audit commenced from 1st April 2021 with an yearly conference with the National Health Authority on 24th March 2021, wherein the audit approach was discussed. Simultaneously, entry conference was held in each participating state by the respective Director General or Principal Director, Central or Principal Accountants General, with the nodal departments involved in the implementation of PMJAY. In June-July 2020, a data analysis of NHA's IT system was conducted in which significant audit findings was presence of suspected or ineligible beneficiaries in PMJAY ecosystem because of usage of uncleaned SCCC database, unrealistic household size, pendency in approval of beneficiaries and hospitals, time taken for pre-authorization approval, delay and pendency in approval and payment of claims, and inadequate validation controls were observed. Further data analysis was conducted again during the course of audit at NHA as well as SHA, and the findings have been discussed in succeeding chapters. After conclusion of audit, an exit conference was held with the NHA on 27th July 2022, wherein the draft audit findings were discussed. Exit conferences were also held at the state level. On 17th February 2023, a presentation was made to the Ministry of Health and Family Welfare, wherein the updated status of scheme implementation was shared by the Ministry with the audit. Responses furnished by the Ministry and the NHA has been considered and appropriately included in this report. Please like the video, subscribe to the channel, share to your friends for dissemination of information on various schemes of the government and how it is getting implemented, how our tax payment is being utilized by the government. Thanks for watching.